Hi, I'm Ken Bargayo, a physical therapy intern at RTRMF. So in this video, we're going to talk about the influence of functional electrical stimulation on motor recovery.
FES restores or blocks damaged nerve activity. All body functions are controlled by the nervous system. FES uses artificial, low-level electrical impulses applied to the nervous system to replace or block the damaged neurons and signals, restoring its lost function. FES device consists of a control box with a battery and electrodes. For foot drop, the device is usually worn in a cuff below the knee. This is where the electrodes can stimulate the nerve that goes to the muscle that would normally lift the front of your foot. At the right moment in your gait, when your foot is about to lift up to be swung forward, the FES device stimulates the nerve and lifts the foot. The stimulation stops when the foot hits the ground again. The nervous system is capable of a change in response to stimulation. Permanent changes are possible with long-term repeated exposure. In patients with complete or incomplete SCI, there is significant increase in stepping responses that have been observed in response to FES. Some patients who were regularly treated with FES demonstrated improved lower limb Asia motor and sensory score and decreased spasticity, indicating some degree of neuromodulation and remediation of paralysis in response to stimulation. It has also been observed that muscles that were paralyzed became active and were under the patient's voluntary control. Researchers also state that FES accompanied by improvement of motor function leads to less diffuse activity in the sensory motor cortex, shifting to focused activity in the weak or affected side.
Even though studies suggest potential benefit of FES-based therapy compared to a conventional therapy, strong evidence supporting an advantage of FES is still missing. Researchers found no significant differences of functional improvement between the intervention and their control group. There is need for determination of optimal stimulation parameters, which seem to be highly objective and is also influenced by the pathological changes in the neuromuscular transmission of the paralyzed hand. All in all, future research needs to pinpoint exact mechanism underlying functional recovery after FES.